that will be the heading of chapter 1. And you can mention the code range also. That is A00 to B99. So this will be the code range for chapter 1. Certain infectious and parasitic diseases, and the code range is A00 to B90. Everyone noted?
Yes, ma'am.
Ma'am, is this the first slide? Sorry for late.
This is the first slide.
Okay.
So after this heading, in the chapter 1, we are going to see an important 4 topics. Okay? So I'll dictate one by one. You can note it. So the first topic under the chapter 1 is HIV. So the first topic we are going to see about the HIV, and the second topic we are going to see about the sepsis. The first one is HIV and the second one is sepsis. And the third topic is MRSA. I'll tell the full form later. Now we can mention only the term, that is MRSA. And the last one is Zika virus. Z-I-K-A. Zika virus. So I'll dictate once again. The first one is HIV, and the second one is sepsis, and the third one is MRSA, and the fourth one is Zika virus. Everyone noted all the 4 topics?
Yes, ma'am.
Okay. So the first thing we are going to see about the HIV. Okay. So what is HIV? What is meant by HIV?
Human
What is meant by
immunovirus.
The full form of HIV is human immunodeficiency virus. That's fine. What does that mean?
The virus that impacts the immune system due to lack of immunity.
Yeah. So HIV is caused by the virus name called retrovirus. The virus name is called as retrovirus. What it will do is, it will be targeting our immunity. So once after targeting our immunity, it will be makes our immunity to become very weak. So that what will happen, if my immunity is very weak, all the possible infection can affect, right? So that is called as HIV. So HIV means it is caused by the retrovirus. It will be affecting our immunity and makes the immunity become very low. Due to that, all the possible infection will affect. Okay, so that is called as HIV. For example, we are a normal LTP. Okay, so surrounding us, we will be having a lot of organism and pathogens. But still we are okay. Why? Because we do have the immunity that will be fight against that organism. If my immunity is very weak, what will happen? Even the small organism will be affecting us. Same concept will be applied in HIV. So if this organism will make my immunity lower, so surrounding all the infection will be affecting me. So that is called as HIV. Okay. So HIV, it is just an infection. So HIV is just an infection. So here we do have 2 things. So tell me, what is the window period of HIV? Do you have any idea of window period of HIV? Or when the symptoms will occur once after affecting the HIV? Do you know?
10 years.
10 years. Very good. So HIV and all, like if at all they are affecting now, and the symptoms will be shown after 8 to 10 years, not now. If at all in between they are going to an hospital or anything and they are doing HIV test instead, then we can find it the patient is having HIV. If not, till the symptom appears, we doesn't know the patient has HIV itself. Because they are not doing any test there. That's why. Okay. So remember one thing, HIV is just an infection. Once after all the symptoms are occurring and it is going to the later on stage, that is converted to AIDS. AIDS. What is AIDS?
immunodeficiency syndrome.
Sorry?
Acquired immunodeficiency syndrome.
Acquired immunodeficiency syndrome. So HIV is an infection, AIDS is a disease condition or a syndrome. Okay. So this is the concept of HIV. So everyone understood the meaning of HIV means?
Yes, ma'am.
So if at all, during your interview purpose, okay, they are asking about the, tell me the specific guidelines of HIV incidence. First, you have to go with the definition. So what does that mean? For example, if they are asking sepsis means, you have to tell the definition of sepsis. Likewise, for each topic, you have to tell the definition. Once after that only, you will be moving with your coding part, coding or your guidelines part. Okay? So the first definition is very important. The treatment wise and all, it is not important for us. Directly, we can go with the code. Okay? Now, take me the code of HIV. Just, you have a book, right? In your soft copy, ICD soft copy, right? Just open it and tell me the HIV code.
Is it 20?
Just search and tell me what is the answer for HIV. Sorry. What is the code for HIV?
B20, ma'am.
B20. Okay. Everyone is searching or
Z21, ma'am.
Z21. Okay. Okay, then some are saying B20, some are saying Z21.
Searching, ma'am.
You are searching. Okay. HIV means what is the main term? What is the main term? No. I'm just asking what is the main term, not asking the code. HIV means what is the main term?
Virus.
Virus.
098.7.
Okay.
098.7.
0?
8.7, ma'am.
0, not it will not come. All the ICD codes will start from
B20 and Z21, ma'am. Both the codes,
B20
ma'am. And
B20 and
Z21, ma'am.
Okay. So I'm just asking how to pick the code, that's all. What is the main term? What is the sub-term? Only that I'm asking you. HIV. So what is the full form of HIV? Immunodeficiency virus. Then which will be the main term?
Virus.
Virus, okay.
Human.
Under the virus? Here in the picture you can see. So what is the main term? Under the disease you have to search. Human immunodeficiency virus. It is a disease condition. So we have two options to search HIV. So first I'll be searching disease. Under the disease I'll be searching immunodeficiency virus. That is HIV. Or under the human also I can search. Under the human you can find immunodeficiency virus, that is B20. So remember, the HIV code will be B20. I'll explain clearly. Before that, just note down, I'll tell you the first point in HIV. Okay. So I'll dictate, mention that it's enough. Code only confirm the case. The first point is code only confirm the case. Code only confirm the case. Code only confirm the case. Have you noted the first point? Code only confirm the case?
Yes, ma'am.
Okay. Under that, mention the first code. Under the first point, the first code will be B20. 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 So, B20 in what are the things we are going to use B20 in sense? Under the B20 code you can mention that is HIV. HIV. HIV symptomatic. You can mention HIV symptomatic. HIV symptomatic. The first one. Okay. And the second one, AIDS. First one is HIV symptomatic. And the second one is AIDS. And the third one, that is AIDS related complex. This all the things will comes under B20. Okay. So I'll mention once again. That is under B20 you can mention HIV symptomatic. After the second one it is AIDS. And the third one is AIDS related complex. And the fourth one is HIV infection. Have you noted all the four?
Once again, ma'am.
Okay. So first point, I'll tell from first one. So the first point is code only confirmed case. Under the code only confirmed case, the first code will be B20. Under the B20 you can mention HIV symptomatic. The second point, AIDS. And the third point, AIDS related complex. And the last one is HIV infection. Have you noted?
Yes, ma'am.
Have you noted?
Yes,
So
ma'am.
this is B20. I'll finish all the dictating part. After that I'll explain. It will be very easy for you. So have you noted about this B20 code?
Yes, ma'am.
Second code. We have completed with B20 and the second code is Z21. Near to the Z21 you can mention HIV positive, asymptomatic. HIV positive, asymptomatic. Have you noted under the Z21?
Yes,
Yes,
ma'am.
ma'am.
Okay. And the third code, once again. The third code will be R75. So under R75 you can note down that is inconclusive serology evidence. Inconclusive serology evidence. Have you noted the third code?
Okay, ma'am.
R75, that is inconclusive serology evidence. Inconclusive serology evidence. Okay. And the fourth code, is Z20.6. Z20.6. Have you noted Z21? I'll dictate fully. And the first point is code only confirmed case. Under the code only confirmed case, we have 4 codes. The first code will be B20. So in B20, the concept will be, the first one is HIV symptomatic, AIDS related complex, then HIV infections. And the second code will be Z21, that is asymptomatic HIV, that is positive HIV. And then R75 is inconclusive serology evidence, and Z20.6 is exposure to HIV. So everyone noted?
Yes.
Okay. So I'll tell one by one. I'll explain. After that, we can go with the next code. So if at all the patient is doing any HIV test at all, first thing we have to check whether the patient is HIV positive or not. Okay. If in case the HIV is positive in sense, we have to check these simple terms, that is symptomatic or asymptomatic. So what is the difference between symptomatic and asymptomatic? What is the difference between symptomatic?
After 10 years, it shows symptoms. Before 10 years, there is no symptoms of the HIV virus.
Okay. So sometime the patient may get admitted because of HIV, but still the patient will not have any symptoms. That doesn't mean about the year also, but we have to check whether the patient is having symptoms or not, even after testing the HIV is positive. So the patient has HIV positive. Okay. So now we have to check whether the patient has symptoms or not. If the patient has no symptoms, directly I will be going with the code Z21, that is asymptomatic HIV positive. So if they are HIV positive, but there is no symptoms, then I'll be going with the code Z21. If HIV is positive, but the patient has symptom in sense, then I'll be going with the code B20. Smaller symptoms also we can mention. So for the HIV patient, starting the patient will have diarrhea, vomiting, sometimes constipation, so weight loss. So these are the major symptoms of HIV. After the skin disease and respiratory problem, it will be going on. It will be continuously closing it. So just the main concept will be like they will be having this weight loss and all. It will be there. That is considered symptom. Okay, symptomatic. So if it's HIV positive, we have to check the patient has symptoms or not. If the symptom is there, I will be going with B20. If no symptoms, I will be going with Z21. Sometime what will happen is, even for AIDS means it is not an infection, it goes for a condition. So then if the patient they are mentioning in the chart AIDS means, I'll be going with the code B20. In this category, I'll be not mentioning Z21. So if it is AIDS, then I'll go with the code B20. If it is AIDS-related complex means after these symptoms have been shown, that is considered as AIDS-related complex. During that time also, I'll be going with the code B20. That is starting stages of AIDS. Okay. So starting stage of AIDS is considered as AIDS-related complex, that is ARC. Then I'll be going with the same code B20. And if it is HIV infection, I'll be going with the code B20. Okay. But it is a general guidelines. If at all you're going and working in a company, the B for HIV infection, we used to mention Z21. It is for your job. But your in general guidance, HIV infection means you have to go with the code B20. If at all you're working in coding part, be clear that your project specific guidelines is different and your general guidelines is different. So in your project specific guidelines for HIV infection, you will mention Z21. But remember, it is a general guidelines. For HIV infection, you are going to mention a code B20 here. Okay. So in what are the concepts we are going to mention B20?
Yes, ma'am.
What? I'm asking what?
HIV symptomatic.
Patient having AIDS-related complex, HIV infection.
AIDS-related complex, HIV infection, AIDS man.
Okay, 1 second.
टिकी का टिकी
For what the patient is coming to an hospital. If the patient is coming with HIV infection, symptomatic HIV which is positive, AIDS related complex, and AIDS means I'll be going with the code B20. If HIV is positive but the patient is having asymptomatic, then I'll be going with the code B21. Okay. And next, test report is we did not get any test report yet. Then I'll be going with the code R75. So R75, we did not get the test report. Then I'll be going with the code R75. That is considered as inconclusive serology evidence. And for exposure of HIV, so if at all the patient is exposure to HIV, but we did not know whether it is positive or negative, then we'll be going with the code Z20.6. So exposure means we will be doing a check. We will do check and whether the patient is having HIV or not, we will find it. But before that, it is considered as exposure. In this concept, I'll be going with the code Z20.6. Everyone understood with all the 4 codes? And at the first point?
Ma'am, Z21.
Z21.
The patient go to the hospital for some other disease. That time HIV is identified, right?
Okay.
That is asymptomatic.
We have to check that. For example, wait. When the hospital for the patient is going to an hospital for some other reason, and during that test they have done HIV and they have tested positive. In that criteria, we have to check whether the patient is having any symptoms of HIV or not. If no symptom exists, I'll be going with Z21. If symptom is there, I'll go with the code B20. That's all.
And R75, can you explain also?
R75 means we did not get the test report yet. Test report we did not get it, since I'll be going with the code R75.
Okay. Exposure not yet confirmed, right?
It's not confirmed yet. Or because maybe the test have been done or may not be. Exposure itself, I'll be going with the code Z20.6. Okay. So for everyone understood all the 4 codes?
Yes, ma'am.
Okay. And the second point is, first point we have completed. Under that 4 codes have been completed. Now the second point is selection and sequencing of HIV. Selection and sequencing. Selection and sequencing. What is meant by the term sequencing means?
Otherwise,
Arranging in order.
Arranging in an order-wise manner. According to the priority, we will be arranging. That is called sequencing. Remember one thing, ICD is completely based on reason for visit. What is meant by reason for visit? What is meant by reason for visit?
what the
Why the
patient
patient
For what purpose the patient is coming to an hospital, that is considered for reason for visit. For example, I am having a fever, okay? So I am going to an hospital, that is the purpose of visit, right? Then they will be starting itself, they will be coding fever. That is a priority. So remember, ICD is completely based on reason for visit. Mostly, I'll be coding reason for visit first. Most of the concept. In some cases, the reason for visit, if at all any associated condition is there in sense, I'll be changing according to the guidelines. But remember, always the reason for visit is very important in this ICD topic, overall topic. Okay. So that is considered the sequencing part, where the priority is important. Under the selection and sequencing, first category, that is patient admitted to HIV and related condition. HIV with that related condition. So, here always remember, if the patient is coming with HIV and also the patient has related condition of HIV, the primary should be HIV code and the secondary should be the related condition. Why? Because, for example, the patient is coming with Kaposi sarcoma. In this picture you can see in this code, the patient is admitted with Kaposi sarcoma. Okay. We can find code first underlying disease. What is meant by code first underlying disease? First we have to code the underlying condition, after that main condition. But under the Kaposi sarcoma itself, they have mentioned code first any human immunodeficiency virus disease, that is B20. They have mentioned clearly, right? So under the Kaposi sarcoma, first we have to mention the B20 code. After that only we are going to mention the Kaposi sarcoma, which indicates the Kaposi sarcoma is a related condition of HIV. So this is how we have to mention, because we don't know now, like for HIV, which all are the related condition, which all are not related condition, we will know, will be not knowing. Most of them will be not knowing. Then what you have to see is, we have to see the reason for this. For example, the patient got admitted with Kaposi sarcoma. The patient got admitted with Kaposi sarcoma. In this case, what you will do? Always the reason for visit is important, right? So the patient is admitted with Kaposi sarcoma. It says first I will be searching the code Kaposi sarcoma. But under the Kaposi sarcoma itself, they have mentioned you have to code B20 first. After that only you have to code Kaposi sarcoma, and they have mentioned clearly. That indicates that Kaposi sarcoma is the related condition of HIV. If at all you know this is a related condition, then you can mention. If not, you can see the condition itself. For example, the patient has histoplasmosis. I think yesterday we have seen this condition. I'll show in the book, okay? Guys, after 1 minute, it is going to disconnect. Join again. The patient got admitted because of histoplasmosis. So, the reason for visit is the histoplasmosis. Then what I am going to do is, I will be searching the histoplasmosis code. Okay. So, under that, they have told you to mention code first associated AIDS B20 first. After B20 only, we have to go with the code B39. Right? So, now what you have to do is, you have to check the patient has HIV or not. Definitely the patient will have AIDS. Why? Because histoplasmosis, AIDS is a related condition. If you don't know it is related or unrelated, if you search the code itself, that will lead you whether it is related or unrelated, they will mention clearly. Like code first and all, they will mention clearly. So then what we have to do is, the first we have to go with the code B20. After that only we have to go with the B39. So now understood about the related condition of HIV concept?
Yes, ma'am. Ma'am, this associated mention only in tabular list.
Yeah, it will be mentioned only in tabular list. Okay?
Okay.
About the sequencing part is, the reason for visit is related condition of HIV. We don't know that is related or unrelated. He is coming with some condition. We have to check whether it is related or unrelated. Then first you have to check the code. Under that code itself, they will mention clearly code first underlying disease. If they mention code first underlying disease, Then it is related condition. Then I'll be coding the B20 first. After that, I'll be coding the related condition as second. Now understood with the first point, everyone? Okay. So now the patient got admitted with unrelated condition and also the patient has HIV. Then what you are going to do first? Which code you are going to mention first?
Unrelated.
Unrelated condition. Unrelated condition as a primary and B20 will be secondary. If it is only related condition, I will be mentioning B20 as primary and the related condition as secondary. For example, the patient got admitted because of diabetes mellitus and the patient has HIV. It is related or unrelated? Whether diabetes mellitus is unrelated. We know, right? It is an unrelated. Diabetes mellitus, if you search also, they will not mention to code first underlying disease and all, they never mention. So then what will we do? What's the reason for visit there? Diabetes mellitus, right? Then diabetes mellitus I'll be coding first. Under that I'll be coding B20 as secondary. So this is how we have to see whether it is related condition or unrelated condition. Now I'll give one example. Tell me the answer for it. The patient got admitted with HIV. Okay? That is symptomatic and got admitted with HIV and symptomatic, and the patient is also having diabetes mellitus. Then how will you code the condition here?
Primary
First unrelated condition and then HIV.
Listen clearly. The patient got admitted because of HIV and the patient has unrelated condition like diabetes mellitus.
B20 first, ma'am, then diabetes.
See, here in unrelated condition, the reason for visit is important. If it is related condition only, default you will code B20 as primary and related condition as secondary. But if it is unrelated condition, you have to check the reason for visit. If the reason for visit is unrelated, then I will be coding the unrelated first, after that B20. If the reason for visit is HIV, and also unrelated condition is there, then I'll be coding HIV first. After that, I'll be coding the unrelated condition. Everyone understood? Understood or not?
Yes, ma'am.
Read again.
Okay, I'll give another example, then you will understand. The patient got admitted to HIV and the patient has related condition.
First HIV and then related condition.
Okay. See, while coming to a HIV with related condition, remember the HIV should be primary and the related condition should be secondary. If the patient is coming with unrelated condition, here I will be checking the reason for visit is very, very important. Okay. So in this reason for visit, you have to check whether it is related or unrelated. So unrelated condition is there. Then the reason for visit is unrelated, right? That I'll be mentioning as primary and the B20 I'll be mentioning as secondary. Now, the patient has unrelated condition and also has HIV. But the reason for visit is HIV in sense, first I'll be coding HIV as primary, after that unrelated condition as secondary. Now understood?
Yes, ma'am.
Okay. Have we moved to the next concept? Next one. Third point we don't want, because we know, right, for Z21, for asymptomatic HIV, we will be coding that way. And R75 also, you can leave that. You can see this third point, because already we have noted all those two, that's why we are leaving it, okay? Okay. So, for example, first time the patient got tested as HIV positive and is symptomatic also. Okay. Then what we are going to do? We are going to code B20. Now, after 1 week, the patient is coming to an hospital for some other reason. Will you code B20 or not? Will you code or not?
We have to code, ma'am.
Okay. After 1 HIV patient is coming to an hospital after 1 year. Will you quote B20 or not?
Yes, ma'am.
Yes, definitely.
Yes,
Because
ma'am.
we have to identify him as an HIV patient. So for every encounter to the hospital, default we have to mention B20. But according to the visit, it will be vary. Whether we have to mention as primary or secondary, it will be vary. But B20 is mandatory because we have to identify the person has got HIV. So for every encounter to every visit to the hospital, B20 we have to mention. This is very much mandatory. Understood? So remember one thing, if the patient is HIV positive, whenever he is coming to an hospital, we have to mention that the patient has got HIV. For that, we have to quote B20 mandatory. For every month he is coming in sense also, every month I have to go and mention B20. Or else if he is coming for 2 years once, 3 years once also, I have to mention B20. Why? Because we have to identify the person as HIV. Because HIV is easily spreadable through sexual contact or through blood and blood transfusion. This is all we have to see, right? So for that, to handle an HIV patient, it is very difficult. That's why we have to mention B20. Okay? Understood?
Yes, ma'am.
Okay. So this will be the third point. First we have seen about the related condition. After that, unrelated condition. After that, we have seen about the every encounter. Okay. And the fourth point, pregnant patient with HIV. And the fourth point is pregnant patient with HIV. Remember one thing, if a woman is pregnant and she got admitted to hospital for any reason, not only HIV, it can be a diabetes mellitus, hypertension, HIV, sepsis, cancer, or any accident, whatever it might be, if she is pregnant, always the primary code will be pregnancy code. Always primary code will be pregnancy. And the secondary code will be the reason for visit. Why? Because in the pregnancy, we are going to deal about two lives. The child is there, the fetus is there, and also the woman is there. We are going to deal two peoples, so that always the primary code will be the O series. After that, for what purpose they are coming, that should be mentioned as secondary. Now tell me, the pregnant patient with HIV, what is the primary code?
O series.
O series means that HIV. Okay. Remember, always the pregnancy code will be starting from O series. All the pregnancy code will be starting from O series. Okay?
Okay.
Yes, sir. No. Guys, I am not getting any response from you. Are you sleeping or you are not listening to the class? We have 57 candidates. I am getting only reply from 2 or 3. What about others? I have to pinpoint you and I have to mention?
No, ma'am.
No, right? Then please do reply at least. I know that is 3 o'clock to 5 o'clock and all. Definitely you will feel sleepy after your lunch. But try to, at least you're attending the session only for 2 hours, right? You're not attending for a whole day. Try to be conscious and be concentrated on your topics, whatever we are taking, these are all important. Okay?
Okay, ma'am.
Okay, now tell me. Okay. So the pregnant patient is coming with heart attack. Pregnant patient is coming with heart attack. Now tell me what code you are going to mention first.
Pregnancy first O series, ma'am.
Second O series, pregnant. Second will be heart attack. So remember, if the pregnant woman is coming with any condition, the pregnancy code will be first. After that, the reason for this. Now tell me, pregnant woman with COVID positive.
Pregnancy
First
code
we code for pregnancy and then COVID.
First pregnancy code, then COVID code. Understood? This will be the fourth point. Now mention pregnancy with HIV. Primary will be pregnancy code, that is O98.7, and the secondary code will be B20. B20 or Z21. According to the symptomatic or asymptomatic, you are going to code B20 or Z20. Noted? And the last one is, if the patient is coming for screening of HIV, I'll be going to code Z11.4. Z11.4 for screening of HIV. If the patient is HIV negative, we will be having a code Z71.7. Even for counseling also the same code. Counseling of HIV and counseling of HIV and HIV negative, we have a same code, that is Z71.7. Okay, so that will be the last concept.
Ma'am, screening can I explain?
Screening for HIV, that is Z11.4. Z11.4. And for HIV negative and for HIV counseling, then the code will be Z71.7. Noted, everyone?
Yes, ma'am.
That's all. We are done with HIV concept. So, what are the things we have discussed? I will tell you once again. After that, how we, if at all they are asking in an interview, how we have to mention also, I will explain. Okay. So, the first thing, we are going to do a two important concept. That is, first we are going to mention the definition of HIV. After the definition, we have to go with the code only confirmed case. Under the code only confirmed case, we will be having a 4 code. So the first code will be B20. In what are the criteria? We will be using B20 inside. If it is AIDS, HIV positive with the symptomatic, AIDS related complex, and the fourth one is HIV infection. In those cases, we are going to mention B20. Okay. And in Z21, it is completely HIV positive, but it is asymptomatic. And Z20.6 is for exposure of HIV, and the last code will be R75. The R75 we are going to mention for we did not get the test reported. In that condition, we are going to mention R75. So this is about the 4 important codes. And after moving with your sequencing part, always remember if the reason for visit will be the primary code, but if the patient has HIV and related condition, HIV will be the primary and the related condition. Important topic, that is about the sepsis. So what is meant by sepsis? What is meant by sepsis?
Blood infection, ma'am.
Very good. It is a blood infection. Okay. After that?
Because of that blood infection, some organs will weaken.
Okay. So remember something, sepsis is a life-threatening condition. Even it causes death also. Okay. The sepsis is mainly caused by a bacterial organism. So sepsis is caused by a bacterial organism, and it is a blood infection, and it is a life-threatening condition. So what is sepsis? It is a blood infection which is caused by bacteria. So sepsis is a blood infection which is caused by bacteria, and it is a life-threatening condition. And it is a life-threatening condition. Have you noted?
Yes.
Okay. And what sepsis will do is, once after this bacteria is entering into the blood, it will be releasing some chemicals. Our own body cells will be releasing some chemicals. Which chemicals, what it will be doing is, it will be targeting our organs. It will be going to target. First, it will be targeting our blood, After that, it will be making our organs to either it comes under the dysfunction or failure. Mainly the failure will be happened in the sepsis condition. So remember, sepsis is a blood infection and it is caused by bacteria, and once after the bacteria is entering into the blood, what will happen is it will be targeting our blood and the chemicals will be released. Due to the chemicals, multiple organ can cause dysfunction or failure. Either a multiple organ or a single organ also will be affected. That too, sometimes a major organ like circulatory system or else the lungs or some important organs will be getting dysfunction or failure. So that is considered as sepsis. So that's why it is called as life-threatening condition. So everyone understood what is meant by sepsis?
Yes.
Yes, ma'am.
Shall I dictate the definition?
Yes, ma'am.
Okay. So already I have told now it is a blood infection caused by bacteria and it is also a life-threatening condition. Life-threatening condition. It will releases the chemicals into the blood. It will be releases the chemicals into the blood. It will be releases the chemicals into the blood and may causes failure of organ. Sorry, da.
It will releases the chemicals into the blood.
It will be releases the chemicals into the blood. May causes failure of organ. May causes failure of organs. Now everyone noted?
Yes, ma'am.
Yes, ma'am.
Ritvita. It will be releases the chemicals into the blood and
Causes
into the
failure
blood
of organ.
and may causes failure of organs. Noted? Now?
Yes, ma'am.
Okay. So under the sepsis, we are going to see three things. First, sepsis, severe sepsis and septic shock. I will be dictating one by one. You can note down with the meaning of it and with the code also. Okay?
The symptoms of sepsis.
Symptoms and all we don't want to know. Just we have to know the definition. Okay?
Okay.
So I'll dictate, just note down. Okay? First, sepsis. Okay? So under the sepsis, we have seen the definition. After that, for the sepsis, we have to mention a single code. If it is only sepsis, I'm going to mention a single code. That is with the organism or without the organism, we have to check. So under the sepsis, we have to check with the organism or without the organism. See, with the organism or without the organism in sense, sometime what they will do is they will be not mentioning which organism have been affected sepsis. Then that is comes in that without organism mentioned. If the organism mentioned, the organism code we can go with that. For simple, the patient has sepsis that is due to E. coli bacteria. They are mentioning the bacterial name itself they have mentioned. Then what you have to do is under sepsis we have to search E. coli bacteria. Now tell the code for E. coli bacteria under the sepsis you can search. Under the sepsis E. coli. E. coli means Escherichia coli.
Okay.
So here, on the sepsis, we have to check the organism is mentioned or not. Okay. If the organism is mentioned, then what we have to do is, under the sepsis, we have to go with the organism. Which organism is mentioned, that organism code I can go with that. If at all the organism is not mentioned, I will be going with the code unspecified organism. I'll be going with unspecified organism code. So that will be near to the sepsis. You can find a code, right? A41.9. That is considered as unspecified organism code that I am going to mention. So in sepsis, what are the things we have to check? What are the things we have to check under the sepsis?
Organism or unspecified organism.
Whether the organism is mentioned or not, we have to see. If at all the organism is mentioned, what I'll do? What we are going to do?
We have to go and check under the sepsis.
Under the sepsis, we have to search the organism. Near to the organism, the code will be there that we have to mention, because specifically the organism has been mentioned. So if the organism is not mentioned, near to the sepsis there will be a code, right? That is A41.9. That is called as unspecified organism code that I am going to mention if the organism is not mentioned. Understood? About the sepsis concept?
Yes, ma'am.
Okay. Anyone, can you tell about the sepsis? What we have to do in sepsis?
But the sepsis, if they mentioned only the sepsis, we are going to code sepsis code, means A41.9. If they are mentioned any specified organism, means we have to go to sepsis. Under that, we check and we code that specified code. Like organ dysfunction means R65.20.
No, that is not. No, that is completely
organ
different.
dysfunction. Okay.
I didn't teach that.
Likewise, we have to check.
See, simple. That is organ dysfunctional. Don't see. That will be comes under next topic. I'll teach that. No issues. Now, just you have to see. They have mentioned sepsis. If at all they have mentioned sepsis, we have to check whether the organism is mentioned or not. If the organism is specifically mentioned under the sepsis, we have to search the organism name. Like I've told, like Escherichia coli, right? Like that organism name we have to search. Near to that, you can find a code. That code you can mention if the organism is mentioned. If the organism is not there, they did not mention what organism it is, then I have to go with the unspecified organism code, that is A41.9. That will be there near the sepsis code, near the sepsis term. Now understood, everyone?
Yes, ma'am.
Yes, ma'am. So this is about the sepsis concept. After that, the next topic under the sepsis is, you can note down, severe sepsis. Severe sepsis. Severe sepsis. Sepsis means we are going to mention only one code. That is, whether the organism is there or not, we are going to see only one code we have to mention. But severe sepsis, so you have to know what is severe sepsis means. You can mention the definition of severe sepsis. That is, sepsis with one organ dysfunction. Sepsis with one organ dysfunction. One organ dysfunction. Sepsis with one organ dysfunction. Sepsis with one organ dysfunction. So here what will happen in severe sepsis? The patient is affected with sepsis. With the sepsis, the patient will have any organ dysfunction, any one organ dysfunction. So that will come under severe sepsis. And remember, in severe sepsis, we have to check two things. So under the severe sepsis, you can split into two. Okay? Under the severe sepsis, you can mention with the organ dysfunction, The first one is with organ dysfunction, and the second one without organ dysfunction. The first one is with organ dysfunction, and the second one is without organ dysfunction. With organ dysfunction, without organ dysfunction. Under with organ dysfunction, we will be having 3 codes. Under without organ dysfunction, we will be finding 3 codes. 3 codes. 3 codes. And write down the first code will be sepsis code. The first code will be sepsis code.
Ma'am, under without organ dysfunction, right?
Under organ dysfunction. Under with organ dysfunction, okay? The first code will be sepsis code. The first code will be sepsis code, and the second code will be severe sepsis code, and the second code will be severe sepsis code, and the third code will be organ dysfunction code. Organ dysfunction. So I'll dictate once again. And the severe sepsis, you have to know the definition of severe sepsis, that is sepsis with one organ dysfunction. Under this, we have to see 2 things, that is with the organ dysfunction, without organ dysfunction. Under with organ dysfunction, we will be having 3 codes. Always the first code will be sepsis code, and the second code will be severe sepsis code, and the third code will be the organ dysfunction. Sometimes the organ failure also can occur. So according to that, we have to check whether it is dysfunction or failure. Okay? Everyone noted under the with organ organ dysfunction, have you noted all the 3 concepts? 3 codes? Okay. Now, without organ dysfunction. Third one, organ dysfunction code. Organ dysfunction code. Okay. And moving with the...
In severe sepsis, they mentioned we have to put sepsis, severe sepsis, and organ dysfunction, right? If they mentioned the specified organism means?
That I'll explain. Just I'm dictating, that's all. I'll explain. Okay. So with the organ dysfunction you have noted. Now under without organ dysfunction you can note that we will be having 2 codes. 2 codes. The first code will be sepsis code. The first code will be sepsis. The first code will be sepsis code, and the second code will be severe sepsis code. The first one will be sepsis, and the second one will be severe sepsis. Noted?
Yes,
ma'am.
That's all. Guys, after 1 minute, it will be going to disconnect. Okay, join again. Okay. I think everyone noted. Yes or no?
Yes,
Okay,
ma'am.
severe sepsis. Okay. I'll explain severe sepsis. After that, we can go with the third thing. So, under severe sepsis, we have seen the concept, right? So, along with the sepsis, we will be having any one organ dysfunction, either any one organ failure also it can occur. So, any organ dysfunction or failure it can occur. What is the difference between dysfunction and failure? search a respiratory. You are not going to search under the sepsis. Now understood?
Yes, ma'am. Got it.
Okay. I think some of you have searched in the internet, right? Those who are told K82.9.
Ma'am, K82.8, ma'am.
K82.8 is the correct answer. That will be there in the book. If at all you search in a book, you will find K82.8.
82.8, yes, ma'am.
Some have been told K82.9, right? You have searched in the internet. What I've told, don't search in internet, right? I think you have Googled it. I'm not telling everyone.
Ma'am, website, ma'am, ICD website.
ICD website. Don't search in that. You need book knowledge. Please don't search in any concept under the internet. Search only in the book first. After that, I'll tell you. After you're completing with all the ICD chapters, I'll be teaching you how to pick code from your ICD data. That I'll explain. Okay, but now, as of now, only book is important. Okay? Yes or no? Everyone understood with this concept of severe sepsis?
Yes, ma'am.
If the organ is not dysfunction or failure, how will you code? First, you will be coding sepsis. After that, you will be coding
Severe sepsis.
severe sepsis. That's all. That's all. That's all with severe sepsis concept. Shall we move with the next thing? Everyone understood with the severe sepsis concept?
Yes, ma'am.
Okay. And the third one is septic shock. Here you can see an example. Severe sepsis without any organ or dysfunction. The primary code will be sepsis code and the secondary code will be the severe sepsis. If any severe sepsis with any organ failure is there, the primary code will be sepsis. After that, severe sepsis. And the third one is organ failure code. Now understood everyone about this concept?
Yes, ma'am.
And after repeat.
Sepsis and secondary code.
If it is sepsis, if it is only severe sepsis without organ failure or without organ dysfunction, the primary will be sepsis and the secondary will be severe sepsis. If, for example, with severe sepsis, any organ will be failure in sense, the primary will be sepsis and the secondary will be severe sepsis and the third one will be the organ failure or organ dysfunction. In the slide you can see, right? Is it visible for everyone?
Yes,
So that's all. And the third one about the septic shock. The third concept will come under the septic shock. Septic shock. So I'll tell the definition of septic shock. You can note down. Severe sepsis with, 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 circulatory failure, circulatory failure, severe sepsis with circulatory failure. Severe sepsis with circulatory failure. Have you noted the definition of it?
Yes, ma'am.
Under the septic shock also, we do have two categories. Note down. That is with the organ failure, without organ failure. Gopinath, what happened, Gopinath? Okay. So here in septic shock, we do have two things. That is, the one is with organ failure, and another concept is without organ failure. So under with organ failure, you can note down, we do have three codes. Under with organ failure, we do have three codes. The first one will be sepsis. The first one will be sepsis. Second one will be septic shock code. Second one will be the septic shock. The first one is sepsis and the second one is septic shock. Septic shock. And the third one will be organ failure code. Organ failure code. Organ failure. Have you noted? With organ failure, have you got all the three codes?
Yes, ma'am.
Okay. Now, without organ failure, without organ failure, we will be having two codes. The primary will be sepsis, and the second one will be septic shock code. Septic shock code. Have you noted, everyone?
Yes, ma'am.
Okay, now I'll explain. So septic shock means with the severe sepsis, the patient will have circulatory failure. Circulatory failure means major organ failure and all will be there. Okay. So in septic shock, same concept. Sometimes major organ failure can be there, sometimes it is not. Okay. Maybe the starting stage and all, the circulatory failure and all will be not there, right? So if in this case we have to search with organ failure or without organ failure. So if it is with organ failure, same three concepts. The first always it will be sepsis. So what is the sepsis code? In the sepsis, what are the things we have to check?
Specified or unspecified?
Specified organism, unspecified organism, same concept. So now the second code will be the septic shock code. So septic shock code, primary code will be sepsis. Sorry, primary main term will be sepsis. Under the sepsis, we have to search severe. Under the severe, we have to see the septic shock. So the primary will be main term will be sepsis. Under the sepsis, we have to search severe. Below the severe, we have to search the septic shock. So what is the septic shock code?
R65.1.
R65.21. R65.21. For severe sepsis, it is R65.20. But it's for septic shock, it is R65.21. Noted? The septic shock
Yes.
code? Now
Yes,
tell me, for organ failure, I'll give an example. That is respiratory failure. Respiratory failure. What is the main term?
Failure.
Under the failure, you can search respiratory.
I'm J96.90.
Okay.
I'm J96.90.
J96.90.
Wait, others can search. Okay.
J96.90.
J96.90. Okay, that's correct answer. Okay, so that will be the third code. For the respiratory failure, the main term will be failure. Under the failure, you have to search the respiratory. J96.90 will be the answer. Okay. Now tell me, without organ failure, what are the codes you have to mention? Without organ
Sepsis and
failure,
septic shock.
Okay. Likewise, here in the septic shock, if organism is not organ is not failure, the first one will be sepsis and the second will be the septic shock. If the organism have been got failure, then I'll be going with the sepsis, and after that septic shock, and the third one is organ failure. Understood?
Ma'am?
Yes, ma'am.
Yes, someone have been asked something, right?
Ma'am, what is the organ failure code, ma'am? We already coded for sepsis with organ failure, right? So what will be the code for third one?
Third one we told now. For respiratory failure, I've given the example now. What's the code for respiratory failure?
J90.90.
J90.90, I think so, right? So that will be the third code. So that will be the answer for respiratory failure, that is organ failure. So everyone understood with all the three concepts, which is very, very important in sepsis?
Yes, ma'am.
Yes, ma'am.
Okay. Now you can go with, shall I repeat once again with all the things?
Yes, ma'am.
Yes, ma'am. First, we have to go with the definition. I'll go very fast. See, first we have to go with the sepsis. In the sepsis, we have to see what is sepsis. We have to understand. Sepsis means it is a bacterial infection, and it is caused mainly it is caused by the in the blood, and it is a life-threatening condition also. So what it will be do is, once after this organism is entering into the blood, it will be releasing the chemicals. So this chemical will target our blood, and also with that, the organ can be dysfunction and failure also can occur. So this is about the concept of sepsis. In the sepsis, we have three things. If it is only sepsis, or severe sepsis, or septic shock, we have to see. In the sepsis, what are the things we have to check in sense? Whether the organism is mentioned or not, we have to see. If the organism is mentioned, go with the organism code. If the organism is not mentioned, without organism, we have a code, right? That is A41.9. That we have to mention. So if in case it is a severe sepsis, the definition of severe sepsis is sepsis with one organ dysfunction or failure. In this concept, what we have to do is, we have to check whether the organism is dysfunctioned or failure or not. If the organism is failure, then what I'll do is, I'll go with the three codes. For example, the first one will be sepsis, second one will be the severe sepsis, and third will be the organ failure or organ dysfunction code. So, if it is not failure or dysfunction, the primary will be sepsis and the secondary will be the severe sepsis. So, if it is septic shock engine, it is more severe. That is, the patient will have severe sepsis with that the circulatory failure like heart failure, respiratory failure and all will be there. In this case, what you have to do is, the primary thing will be always sepsis, and after that, septic shock code, and after that, if the organism is failured, I'll be going with the organism failure code. If the organism is not failured, I'll be not mentioning the organ failure. So that's all. Everyone understood the concept?
Yes, ma'am.
Okay.
Yes, ma'am.
And next you can mention the next heading here under the sepsis, that is supportive document. Supportive document. Supportive documents. Supportive document. Have you noted the heading supportive document?
Yes, ma'am. Yes,
Okay, I'll make it. Note down. The first point. If blood and urine is positive, if blood and urine is positive, code sepsis. cold sepsis. Cold sepsis. If blood and urine is positive, cold sepsis. Have you noted the first point?
Yes, ma'am.
Yes, ma'am. The second point, if blood is positive, urine is negative. If blood is positive, urine is negative, cold sepsis. If blood is positive, urine is negative, cold sepsis. Cold sepsis. And the third point, if blood is negative, urine is positive, if blood is negative and urine is positive, then it is considered as urosepsis. Then don't code. Have you noted all the 3 points?
Yes, ma'am.
Yes, ma'am. So supportive document is very important in most of the conditions. Yes.
Points are similar only, no, ma'am? For both scenarios, I have to code sepsis only, no?
First 2 things we have to code sepsis. Last one, urosepsis. I'll tell you, okay? So simple. Supportive document is very, very important in most of the concept. That too, sepsis is very important. Supportive document in sense, by doing this test, we can find it whether the patient is having sepsis or not. That is considered the supportive document. So mainly to find out sepsis, they will be doing blood culture and urine culture. So blood test and urine test. If blood test and urine test both are positive, then it is considered as sepsis. We can code sepsis. If at all blood is positive but urine is negative, even though blood is positive, right? But urine is negative. The thing is that the sepsis is a blood infection. So in the blood we got positive. So we can code as sepsis. We don't want to see urine test or not. If blood is negative but urine is positive in sense, so a sepsis is a blood infection. It is not a urine infection, right? But in the urine, we have seen sepsis in sense, then it is considered as urosepsis. For urosepsis, we will be not coding any concept over there. We will be not seeing any code at all. So if you see in alphabetical index for urosepsis, you will never find any code. So that's why for the urosepsis, you will be not coding. Okay? So understood with the supportive documents, everyone?
Yes, ma'am. Yes, ma'am.
So that's all. That's all with the supportive documents. Okay. Now we can go with a few questions. Okay. This question will get confused for you actually. Okay. I'll dictate. I'll tell you. Okay. Just tell the scenario of it. Okay, you can note down the question itself, which will be helpful for you. Okay. The first question is, physician documented as sepsis. Physician documented as sepsis. Sepsis with organ failure in discharge note. A physician documented as sepsis with organ failure in discharge note. Physician documented as sepsis and with the organ failure in discharge note. So have you noted the question?
Yes, ma'am.
Okay. So here what we told, the patient has sepsis and with the organ failure. That's what they have mentioned. So sepsis with organ failure means what it is? What is the concept?
Severe sepsis.
Severe sepsis. The definition of severe sepsis itself.
Severe sepsis means sepsis with organ failure, right? Organ failure or organ dysfunction. Then it is considered as severe sepsis. In severe sepsis, how are you going to mention the code? What is the primary code of severe sepsis?
Sepsis.
With organ failure? First will be sepsis. First one sepsis, second one will be severe sepsis, and the third one will be organ failure. Everyone understood with this concept of this question? Yes. And the second question you can note down. If physician documented as sepsis, and organ failure and discharge note. A physician documented as sepsis and organ failure and discharge note. Here, tell me how the answer will be there. If you see this slide, you will not understand. Why? Because if the slide is visible to everyone?
Yes,
ma'am. Yes, ma'am. If at all it's not visible, just check your network. See, what is the condition I've given now? Sepsis and organ failure, right? So how will you mention the code?
Sepsis and severe sepsis, organ failure.
Don't see this slide.
Yes, ma'am.
Don't go.
Severe sepsis, only code for sepsis and organ failure. Yeah, very good. They have mentioned and, right? And means what? It is not a linking condition, right? With this a linking condition, so you have mentioned the severe sepsis. Sepsis, severe sepsis, organ failure you have mentioned. But here, sepsis and organ failure, right? Sepsis and organ failure means what? It is not linking. That is, organ failure is not due to sepsis. It is due to some other reason. That was the meaning of sepsis and organ failure. In this concept, first the primary code will be sepsis and the secondary code will be organ failure. In this concept, we are not going to mention severe sepsis because it is not a linking condition. Understood? With this sepsis and organ failure, which will be the primary code?
Ma'am, sepsis with organ failure means we need to go sepsis, severe sepsis and organ failure. Sepsis and organ failure means sepsis and organ failure, right?
Yes. If it is mentioned with only, I will be going with severe sepsis. If not, I will go only with organ failure. I will not mention severe sepsis. Now understood with second concept? Yes, ma'am.
Ma'am, in sepsis with organ failure also, sepsis is the primary and organ failure is the secondary, no, ma'am?
No. Sepsis with organ failure means it is considered as severe sepsis. Then the primary will be sepsis and the secondary will be the severe sepsis and third will be the organ failure. Ma'am, but here they mentioned severe sepsis, ma'am, secondary code. In the picture you don't see it. That's wrong actually. Okay, ma'am. Okay. If at all it is mentioned and means sepsis will be primary, organ failure will be secondary. In this case, I will be not mentioning severe sepsis. Okay. Only if at all it is mentioned with, I will go with sepsis, severe sepsis and organ failure. Understood, everyone?
Yes, ma'am.
Okay. And the third question you can go with, if physician documented as sepsis and organ failure is due to cancer. A physician documented sepsis and organ failure is due to cancer. Organ failure is due to cancer.
Sepsis, cancer, sepsis, cancer and organ failure.
Sepsis I will mention first. They have mentioned and. Then organ failure itself, they have mentioned the organ failure is due to cancer, right? Then the cancer will be secondary. After that, the organ failure. So here, what are the things we have to check in sense? Sepsis, the organ failure is because of sepsis or not? Only that we have to check in this concept. Understood, everyone?
Yes, ma'am.
Yes, ma'am. So that's all. I'll dictate 2 questions, okay? While coming tomorrow, you have to find the answer. Okay?
Okay.
I'll dictate, just make it fast. Why? Because after 2 minutes, 3 minutes, it's going to disconnect. Okay? So make it fast. The first question is, the patient diagnosed with sepsis, acute kidney failure, the patient diagnosed with sepsis, acute kidney failure, and bladder cancer, the patient diagnosed with sepsis, acute kidney failure and bladder cancer. If the cause of acute kidney failure is sepsis, and reason for admission, if the cause of acute kidney failure is sepsis and reason for admission. Everyone noted the first question?
Yes, ma'am.